Well, here we are on this interview on Climb. Is very exciting. It's all about nutrient depletion and point of service. And here I have Pam Piotrowski. Did I say that right?
Yes, you did.
Oh my gosh, I love it. And our very own Brad Jones with RMS, Pam with TRC. Pam, why don't you tell us a little bit about yourself?
So my name is Pam Piotrowski, and I'm a product manager for TRC. And we, as you know, TRC launched in 1985 with Pharmacist Letter, and now we just grew to have a wide range of offerings that basically provide unbiased, content-focused decision support resources that really focus around medication therapy advice, natural medicine resources and tools, sterile compounding, technician training, a whole host of different resources for those pharmacy teams and physician teams. On a personal note, I am also a pharmacist. I've practiced for many years, mainly within the community sector, and originally from Baltimore, D.C. area, and have grown west and have now landed in the South Texas, Corpus Christi area.
All right. Very good. Very good. Well, great to meet you, Pam, and our very own Brad Jones. So Brad, give us the scoop, Brad. Give us some insight here today. Tell us a little bit about yourself.
Hello, Gio. Well, as I hope many of you know, we started RMS 22 years ago, and in our focus, our mission statement is to make our clients the most profitable and customer-centric in the industry. So we really focus on helping you do that and helping you improve patient outcomes. So when TRC Health and we got together to create an interface for their database into our POS system, it was just a match made in heaven.
Well, talking about being patient-centric, this partnership is wonderful for all of that. And so why is nutrient depletion important for pharmacies?
I think there's a couple of reasons why this area is so important to pharmacies. First, patients don't normally consider nutrient depletion risks when they're taking their medications or undergoing treatment. So they're thinking more about those big bucket side effects. So what interactions am I going to have? If I'm going to have stomach upset, do I need to look out for some food interactions, things like that? And some of these nutrient depletion interactions aren't even called out on patient counseling support systems. So, when you think about some of those big examples, like patients that come in and they're taking metformin, we may want to recommend a B complex, or if they're taking PPIs, may recommend a B complex, or, if they're taking estrogen, thinking about adding magnesium or folic acid supplements to their diet. So it just really allows pharmacists to identify those missed opportunities and to really help that patient avoid those side effects before they happen, and to that sale that supplement. So rather than losing it to another retailer later. So it's all about patient outcomes and keeping their patients healthy.
So it sounds like it's real important to pharmacies.
Absolutely.
Right?
It really is. And when the healthcare system moved towards this whole patient outcomes concern, and that goes all the way down into pharmacy. As Pam mentioned, when these side effects happen, it can cause patients to stop taking their meds or not take them properly. And fixing the side effect can have all the difference in the world. So not only do you improve the patient outcome and you make that patient a patient for life because you've served them and they trust you, you also boost your bottom line. So you're helping them, and as a side benefit of that, you increase your profits.
All right. Well, to that end, do you think that a pharmacy has to focus in retail sales to succeed with nutrient depletion?
Not at all. I don't think so at all. Because nutrient depletion recommendations are not about retail sales, really. It's about improving patient outcomes. It's about helping the patient, serving the patient, making them feel better, and then having them comply and taking their medications properly and on time. And like I mentioned, the benefit of that is also increase your bottom line, but you don't have to be focused on retail sales.
Mm-hmm. Mm-hmm.
No, absolutely. I mean, Brad, to your point, it's while we normally think about nutrient and supplement sales as a community pharmacy exercise, because we can take that, it's easy for them. The pharmacist can take them to the product and put it in their hands while explaining the benefit and just making sure that that patient has it before they leave. But really, in all areas of pharmacy, they can succeed in nutrient depletion education through that team. It's about that team collaboration with other healthcare providers, with that patient's healthcare team. So whether it's during the patient's discharge process or through that transitions of care, or even just talking to that patient's primary care physician or the caregiver and let them know what that patient may need and what some of the risks are, and to make sure that we are, as a team, ensuring that that patient gets the best possible care and treatment that they need. So it just, when you think about it, it just allows all pharmacists to be leaders in those discussions. And I think our product can really assist with that.
Now, you talked about teamwork and collaboration, and the two of you have come together. RMS is the first company that TRC has interfaced with. What drew your two companies together? Brad, I'll shoot that question to you first.
Well, we were searching for a company that had an independent database, that wasn't owned by a manufacturer of these products. Because I think that's important. It gives credence. It gives to this being science-based, and that's really what I was looking for. So I found them at a conference, and then I considered to be a match made in heaven, and we got together and started talking.
Mm-hmm. Yeah, I mean, TRC has several relationships with other companies to provide these types of integrated solutions, but this is truly the first POS solution that TRC has been able to partner with, so it's super exciting for us as well. The conversation started because TRC has the ability to be able to provide a broad spectrum of inventory connections, because chances are that RMS client has that particular product that we have in our system, what that client has on their shelf. So it just brings that confidence to the information or to the products that they're providing to their patients. I mean, we have a full range of coverage. I mean, our database approximately covers about 93,000 different labels, and we house about 1,500 monographs for natural medicine products within our database. Goodness. And when you think about that, that's about 3 times the amount of what our competitors do. So that means that when that pharmacist goes to that product on their shelf, chances are we have that specific product as a source of information within our system. So that just builds that confidence and that comfort level of that pharmacist having that conversation with the patient.
Having that data right at the point of service is just awesome. Absolutely awesome. So what do you think some of the advantages of integrated point of service nutrient depletion program are? I can feel a bunch of these advantages, but go ahead and why don't you tell our viewers some of the advantages?
Yeah, I think it's just the seamlessness of the process. When you have an integrated system, you can provide that immediate identification of those patients that may be at risk, and during that same visit, have that pharmacist educate and assist that patient in obtaining all the medications and supplements that they need to treat their condition and to minimize those side effects, which is fantastic. So, when you think about, as you minimize those side effects, if they're not having really bad interactions or bad side effects because they're missing that nutrient, they're going to be better adherent to their medications, which is going to allow them to be successful in their treatment. And it's going to result in, again, those optimal patient outcomes, which patient's happy, pharmacist is happy, they're confident. It's a total healthcare win.
Yeah, and when that prescription gets filled, if you're just getting this information from your pharmacy system, that prescription might have been filled 5 days ago. The pharmacist that filled it may not be even in the pharmacy. So having that information at your fingertips right there at the point of service is just huge.
Mm-hmm. Awesome advantage. And me as a patient, well, I'm going to be happier, right? You're taking good care of me and your community. I love it. All right. So how would you recommend a pharmacy get started with natural medicines and nutrient depletion program if they don't already have one today?
They have to start. They have to make that commitment, make that leap into doing this, understanding that and their attitude, their approach has to be, I'm doing this to improve my customers' health, to improve the outcome of what they're doing. I'm trying to help them. As I mentioned before, yes, it's going to have the side effect or the advantage of increasing the bottom line, but that's not how you go into this. You go into this knowing that you're helping the patient, and then you have to give your staff training. So that, I think that's the leap. That's where you have to take the leap. Yeah.
Yep. Yep. I would totally agree. It's about providing that pharmacist with an unbiased source of information that they can rely on to confidently provide that information. And when they have that comfort level, then they're more willing to jump in. So then they're going to go for it. They're going to go and have that conversation. And I think that's the beauty of the TRC and the retail management solutions relationship. It just allows them to be able to begin that journey with confidence, to be able to help identify that natural medicine and supplement opportunity with their patients and conveying that information to the patient in an effective way and in an impactful way. Natural medicines and supplements, we know, are growing in popularity every year, and pharmacists are the most accessible and reliable resource for that medical information within the community. So now we're putting it in their hands. We're putting it right there front and center. So it allows them to use that in their holistic view of that patient's profile to kind of put that missing piece of the puzzle in the patient profile and making sure that patient is taken care of.
Well, there you have it, folks. Nutrient depletion and point of service. And Brad says, get started. Listen, healthcare. Care is your last name, okay? This is definitely evidence that you care by putting together a nutrient depletion point of service program in your pharmacy. Brad, Pam, what a joy. Great to be with you both.
Thanks, Gio.
Thank you so much.
Thanks, Pam.
Thanks.
Bye, everyone.